Good afternoon, everybody. I see the participant list is still populating, so I'll go a little slow for the first minute or two. Um, Allow everybody to catch up. Really pleased for this opportunity to do the first of what I imagine is going to be several of these town halls over the summer as we get more information on the policies of the college, on how we're going to be managing the persistent, the continued danger of coronavirus, and also to try to bring as much current information to you as possible. This is a recorded town hall, um, and so we're doing that because we're going to post this on the web and try to make it available to as many people as possible. We're really grateful today to have Dr. Scott Ratson from the CUNY School of Public Health, who will be, managing the primary presentation today, which is about the status of the vaccination, about how it works and how people are responding to it, what, if any, the dangers are, and why. I'm not going to be shy about saying this unless there's a really good reason not to get the vaccination. Why it's a great idea to get it. I got mine as soon as I was eligible. I know that most of I'll say all of senior staff did the same thing, and it is my advocacy point, is the single most effective thing you can do to approach normality as a society, but also you as an individual, you as a member of your family. We also realize that that is not a position that everybody comes to automatically. And so we wanted to make sure that we were both giving you the best information we have about how the vaccine operates, but also give you information about how the vaccinations and vaccination status is going to interact with our efforts to keep everybody safe on campus and return as much as possible to a normal moment. We're on this, so we're going to do a spotlight view. So whoever's speaking will be spotlight lit in this conversation. But I want you to know who else is on the call. Our provost Tony Liss is here. Our vice president of enrollment management and student affairs, Celia Lloyd, is with us. David Robinson, who is in charge of facilities on campus. Ken Iyer, who's in charge of operations and is also the campus COVID coordinator, is also with us on campus. My senior advisor, Didi Mozaleski, who's also the executive director of our foundation, is here. We also have two faculty members that are with us. Adriana Espinosa is with the Colin Powell School and is a member of the psychology department and has done research on where people's student thinking is around the vaccination. Also really pleased that the director of our Black Studies program, Vanessa Valdez, is with us. She was largely responsible for urging this early town hall into action. And so as reward for her efforts, I've asked her to moderate the session, and would like to ask her to say a few words before she passes the mic to Dr. Ratson, who will be making the initial presentation today. Just want to emphasize today that the main thing we're going to be talking about is the role of vaccinations in the pandemic. We will have some information about CCNY policy in regards to keeping everybody safe, but this is very much a kind of unfolding picture. And so there'll be some questions we can't answer yet, but we'll tell you why we can't and what we're looking for before we can get to an answer. And so we want to just really make sure that everybody is as up to date as possible on this information. Professor Valdez, my pleasure to ask you to come to the mic and get us started.
Thank you, President Boudreau. I really want to thank you and thank everyone on this call for coming together. This call really came because as the director of Black Studies, I know that throughout the semester, I had been getting emails from students who either were directly affected, either they themselves had contracted the virus or family members. And then as conversation regarding reopening kicked in, there were anxieties about how this was going to happen, anxieties about the vaccine. How are we going to do this? Am I going back? Is City College being in person 100%? How are we moving people? All of that. And then, as we moved forward, I'm friends with a bunch of staff members who themselves started voicing their concerns and their worries. And so I really want to emphasize to our audience that the purpose of this also is that we have an honest and frank conversation, right? So any questions, any doubts that you have about not only the vaccine, but also CCNY reopening, these are the folks that are on this call can answer your questions. And I really appreciate that this is the first of what will be a series of these conversations, because it is not only my impression, but I know to be true that this CCNY administration, particularly President Boudreaux, Provost Liss, and the entire executive cabinet is actually invested in bringing us back to campus safely, all of us, 100%. And so we may not be 100% in this fall, but that is their primary perspective. That's really what they want, is to make sure that we're all safe. And so with that, I'm going to pass the mic to Dr. Ratson for his presentation.
Thank you very much. Thank you very much, Professor Valdez and President Boudreaux. Really, thank you really for setting the stage and your personal testimony to the importance of vaccination as fundamental to building back better, to getting us back to where we have a society that might not be, as it were, pre-COVID, but certainly will be protected. So thank you for the opportunity today. My name is Scott Ratson. I'm a professor at CUNY School of Public Health. My background is as a public health physician, also with some expertise in health communication. I edited the Journal of Health Communication. And before joining CUNY, I was at the Kennedy School of Government as a senior fellow, working on multi-sectoral engagement. And at that time, even looking at the vaccination challenges that we had in New York, as you may recall, with childhood vaccination and measles. But I came to CUNY, and I've been really focusing on health communication. And we have a whole program, master's program in health communication for social change. And it's all about getting the proper information that people can use and understand and make appropriate decisions. So in short, this is what's happened though. The last administration really highlighted the fake news, if we call it. And as we know that the most trustworthy source in the United States and frankly in the world had been the CDC, but not only saying the CDC and Anthony Fauci also as the chief medical advisor have been the people that we try to trust today, but I say we try because they are also under attack for many different reasons. But I was here to talk today about the promise of vaccines. And in March 2020, when this was first a pandemic and in the outbreak in New York City, we began looking at New York City residents, and we did surveys. But what was clear at the beginning, and what we said in our first actually grand rounds in April 2020, is that we knew that the vaccine would be the showstopper, and it was our only way that we could really end the pandemic. But vaccines are only valuable if they are in people's arms or bodies, and it's vaccination that we're all aiming for today. So to remind people, because a lot of the questions have come into place here of how vaccines are approved. This has been quick. People unfortunately heard warp speed, and warp speed is science fiction, but nonetheless, we did go through a trial. The mRNA vaccines did not just start in March of 2020. There's a lot of science behind them. And having also worked, I should say, even before academics, I spent some time in the pharmaceutical industry and also for US government. There's a whole system in the regulatory process, and we call these phase 1, phase 2, and phase 3 trials. And if you are reading the slide, you can see we start with a small group of people, we make sure it's safe. A larger group of people where we also look at the amount of vaccine to give and the timing. And in this case, of course, there were more than one injection. And then thirdly, thousands of people in the phase 3 trial. And all of these studies have people of different ages, gender, and diversity that follow FDA guidance. And I'll continue just a couple more slides on this. The FDA was established last century, well, almost in the 1920s, but it has a long-standing and careful process of both medicines and particularly vaccines, which are also biologics. These are tested thoroughly, And, as we mentioned, this has been record time, but yet there have been 3 vaccines that have received FDA emergency use authorization. That's the Pfizer-BioNTech, the Moderna, and the Johnson & Johnson vaccines. And there are other vaccines that are in phase 3 trials. And there are other ones that have been approved in other countries as well. The FDA approval looks primarily at safe and effective, particularly a vaccine. You're giving it to someone who is healthy. So it has a higher standard of safety and effectiveness, and then the benefits outweigh any risks. And this goes through a long peer review process, which means both internal people, experts that they bring in, and even before it actually has the emergency use authorization, there's a committee at FDA, which has outside advisors, which are professors from throughout the United States. And then there's an advisory council or advisory committee of immunization practices, which the CDC also convenes. And that includes the American Academy of Pediatrics, the American Academy of Family Physicians, and other experts. So there's a lot of different ways that the trials are looked at from multiple perspectives. And then following the approval, there's monitoring and overseeing of the vaccine. And we call this post-marketing, or sometimes even phase 4. And this also shows that the vaccine is produced with the same quality standards that would be necessary. So it's replicable in terms of its efficacy and ability to stem the disease in the people who receive the vaccine. And that's also the follow-up that continues. And then there's ongoing monitoring. And just to remind people, there's one thing about what is a side effect versus an adverse event, but a lot of the side effects that people get are normal and expected. You have soreness in your arm, a passing headache in some cases, a slight fever in some cases, but these are normal and considered mild and not significant. But the most important piece is that the advantage of being vaccinated is nobody has been dying from the vaccine or the disease after they have a full course of vaccines. And I'll remind right now that over half of New York City residents have at least one vaccine, 52% according to the city this morning. So people are realizing the advantages for this. I'll go a little bit more into the 3 different vaccines that may be interested in knowing that if you have the Pfizer or BioNTech vaccine, it's the first dose and then 3 weeks later, the second dose, but you don't really have the 95% effectiveness until 35 days past the first dose. In the Moderna case, it's a little bit longer, and the second dose in 28 days. And sometimes people get it 26 to 30 days. It's not, the second dose is not set in stone, but frankly, 2 weeks after the second dose, you get the full protectiveness, which is about 94%. And with the Johnson & Johnson, it's a little bit quicker. The effectiveness is a little bit lower, but that doesn't mean that it's not effective in preventing the sequelae of COVID-19. Nobody has died from COVID-19. It prevents hospitalizations with the level of mortality that would have been seen without vaccination. So all 3 of these are approved, and all of them have the benefit. They all also have side effects. Like I said, chills, headaches, pain, tiredness. I mean, I've had, and my family's had both the Pfizer, BioNTech, and Moderna. Some of us have had different levels of headaches and tiredness, but that's all, it's only a group of 4. Many of you might probably know someone who's had these vaccines. And similarly, you see the difference. The mRNA is the newer technologies that the Pfizer Moderna are, and the adenovirus vaccine is the J&J one. Neither of these have a live virus that is injected. You cannot get the disease from the vaccine. And that's really key here to think about. What they all have in common, they all work in a way that vaccines have been working. And we've known all about vaccines since the 18th century, since the smallpox vaccine. And we have got rid of smallpox from the entire planet with the successful vaccine over the last century. We've almost got rid of polio from the whole planet, but we certainly have it. It's gone from the Western Hemisphere. So these vaccines work over time, and they all work the same way. That if the actual virus shows up from the environment, and you've been vaccinated, your body knows that the virus doesn't belong and fights it with the antibodies and the other cells that the body has produced and remembers what they will have seen from the cells, that is, if I could use that term, from the vaccines. All of them went through clinical trials. Thousands, if not millions of people already here in the United States and New York have had these vaccines. None had the live virus, as I mentioned. And we're trying to reach community protection. And I remind people, just like you need to know how many firefighters and fire hydrants you need to protect against fire, you similarly need to do the same with vaccines. We need to get a percentage of the population, and in this case, we were saying 70% of the people have to be protected, which will protect almost everyone. That if we get to that level, but some people have not got the vaccine. And the graphic on the right was in the New York Times of the anti-vaxxers, which was their article saying they don't want it. But we continue to hear this term vaccine hesitancy. And vaccine hesitancy is probably not the major issue. People are not getting the vaccine. It's a story that's out there. And people are saying that maybe we don't have the numbers yet because of hesitancy, but really the issue is access. And we've seen that with our data, very different in the 5 boroughs. The Bronx has been trailing, and even parts of Harlem more as well. But we're all continuing to hopefully get to that number of 70%. But I also saw it in my research, and we have this project I skipped over at the beginning called CONVINCE, which stands for COVID New Vaccine Information, Communication, and Engagement. I've been leading this effort, and amongst that, we did a study with a group called Frisia of looking at patients when they're going in to see their doctor or primary care provider, what they thought about vaccines. And this was national data, and about 138,000 patients, at least for this piece that we published. And what we found is people really are not hesitant. They're ready. They just can't get the vaccine. And you might recall how difficult it was for some of you who tried to book early on. And there are people that are avid and ready. And that's the top. At this point in March, it was about 12%, or 1 in 8 people couldn't get it, but they wanted it. 24% were receptive. And in some cases, these were people, they would go in to see their doc, and the doc would say, well, we don't give it here, but you got to go across town, get on a bus or get on a subway and so forth. And a lot of those people didn't want to do that. So they're receptive, but we needed to make it easier for them to get it. And then there's some people that were neutral. They didn't know about the vaccine, believe it or not. A lot of people were finding didn't know about it, or they thought it cost something, or they thought, oh, I'm going to do fine anywhere, wearing my mask and not going out and so forth. And those were neutral. So frankly, for all of you who are listening, we're hoping that you're either in the vaccinated or the ready column. There are a percentage of people that are resistant. And right now, again, to get to that 80%, 70, 80% herd immunity, we need to focus on those who are vaccine ready. And that's the hope of what we're doing here today as well. And then finally, President Biden has said, people are showing up. He thinks more and more people are getting the vaccine, and they don't believe that there'll be a large percentage of Americans who would get it. There's a month of action that the president has just launched. We signed up with that with CONVINCE. We're helping advance the month of action that should get to the 70% by the 4th of July. And hopefully all of you will have already been on that path, or are considering, or avid or ready, or moving from neutral to getting that. So with that, I'm going to turn it back over to the president. And thank you for the opportunity today. I know there's a Q&A and other pieces that are going on. But I'm happy to engage in questions, and also thank the esteemed faculty and others for joining. Vanessa for the outset of the importance of this. It is all about dialogue. And again, President Boudreau for really setting the stage so well here today.
Thank you, Dr. Ratsin. I would like to start by asking for, those of you that have been monitoring the Q&A, and anyone who maybe has questions specifically related to the vaccine and vaccination status, the science, the nuts and bolts of Dr. Ratsin's presentation, to sort of foreground those questions, and then if not, we can move into a quick presentation about where our policies are, and then we'll open it up for kind of a open tent Q&A session. But are there any questions specifically for Dr. Ratsin on what he presented that hasn't been answered in the Q&A? And so I'm going to ask anyone who's been monitoring the Q&A to give me a sense of something that maybe has not been answered that's relevant to Dr. Ratsin's proposal. Yeah.
I'm sorry, I would just ask, could you speak to, there's concern among women on campus regarding the vaccine and childbearing. That has been voiced to me about what we know and what we don't know with regards to women who would like to get pregnant in the future, and don't know how the vaccine may interact or affect.
Mhm. Vanessa, that's an important question, and one that we continue to receive in a number of these town halls. First of all, the vaccines are approved for from 12 to 17 and up, so women of reproductive age. By all means, it's been approved for that. The American College of Obstetrician, Gynecologists, and others are all saying that the vaccine has met the safety standards that they believe are appropriate and so forth. There's no evidence to suggest, or no data that has certainly been out there, that people or women are at any increased risk. The more risk one still has is from getting COVID. So the vaccination, any one of the vaccines have been approved, and women should take it. If you do have any question though, and at certain times of pregnancy, clearly people have other opportunities for interaction, whether it's with other healthcare providers. It's always good to have the kind of discussion, also to have the confidence. In fact, we say we shouldn't be calling people vaccine hesitant. We need to build vaccine confidence. And that's kind of the piece here, to have confidence in that you're getting good information from your provider, from your university, from your friends, colleagues, and others. So that's what I would suggest. And clearly, the vaccines should be on everybody's list, male or female.
Let me then just say, I think I can do this pretty quickly. Say a few things about where we're at policy-wise for the fall. What we've been doing in the 14 or 15 months since most of you left campus, and then we go back to a Q&A. So first of all, here's where we are at the university level as far as vaccinations and testing is concerned. And I want to emphasize that this is a rapidly evolving situation. The vaccines do not currently have final FDA approval. It's emergency FDA approval. So a lot of the things that you've been hearing are pending final FDA approval on some of these vaccines. Right? So university policy right now, the easiest statement of what university policy is you can only, starting August 2nd, you will only be allowed on campus if you have proof of a vaccination, that you've been vaccinated, or proof that you've got a negative COVID test in the last 7 days. The university is working out protocols for COVID testing. We have heard that every campus will have COVID testing facilities on campus. We believe that these COVID testing facilities will be free of charge. I want to say really clearly, if you've had a COVID test, it's not pleasant. So one of the things that you get if you're vaccinated, apart from vastly improved health, is you get to avoid having somebody stick a swab up your nose and count to 10. It's not the best way to spend 10 seconds, I guarantee you. So that's for everybody. Once August 2nd comes, that is the date that we are beginning formally to repopulate our campuses to a certain extent. Everyone, faculty, staff, students, visitors who come to campus must either demonstrate that they've been vaccinated or demonstrate that they've passed a COVID test in the last 7 days. We do not yet have the details of the testing protocol. That's TBA, but there is going to be an effort to make it as convenient as possible, meaning that we will have those test sites on campus. I want to also say that for those of you that are having trouble getting vaccinated, we're a vaccination site at City College that is open from Thursday through Sunday. I visited it a number of times. You move through that vaccination site really, really quickly. I think people are, you wait in line for 5 minutes, you get a shot, you have to wait for 15 minutes, and then you're out the door. You no longer even need an appointment. You can just drop in on our site and all sites and just get vaccinated that way. There was a question about social distancing and will it be possible for people to be socially distanced on campus? And I actually have two answers to that. The first is we are working as a campus right now to develop for faculty and staff social distancing um, uh, plans for various offices. And those plans are going to include things like, staggering when we bring people back in, right? So if there are 5 people working in an office, maybe on any given day, only 2 people will be working in that office, right? So that we should be able to preserve social distancing and do the same thing in hallways and elevators and all of that. So that's one answer, is that people who are supervising people on this campus are working really, really carefully and hard to make sure that by the time August 2nd comes along, everybody who's expected to report to campus will know exactly when and how they will do that. There is also, as part of that reporting requirement, there are also links to HR where you can request an accommodation, and one of those accommodations is the reasonable accommodation process that we've had on campus forever for people that are in one way or another have difficulties doing work. But the other is a specific set of accommodation requests that can be made in relationship to COVID-19. So, are you of a certain age? Do you live with people who are maybe immunocompromised or something else? Are you in a small category of people for whom the vaccination doesn't produce the level of immunity that it produces in the general population? So there are ways that if you truly have difficulty coming to campus and complying with the return to campus request, that you can be exempted from that by filing that accommodation form.
There's a question in the chat. I wonder maybe Dr. Ratson could answer, which is a person who had a bad case of COVID and had a very bad reaction to the first Moderna shot and is wondering if he should get the second shot.
Well, I hate to thank you for the question, but I hate to give individual results based on advice based on 2 data points. I would say first, yes, it's great to get the first vaccine. 2, to get appropriate medical care, to have the diagnostics, or if one was fully infected and has antibodies, and likely to go speak to a physician or provider before getting the second dose, with the idea that they should complete the dosage. But I just don't want to give direct medical advice other than saying everyone should get 2 doses. And if you had the first one, there is opportunity to still get infected, as I showed on those slides, that you don't have complete coverage until you get the 2 doses. So I hope that answered it well enough.
Thank you. Let me follow that up with another one that you may not want to answer, which is if you're allergic to the flu shot, should you worry about the COVID vaccine?
Well, again, it's sort of the flu shot. The flu shot is different each year. There are different types of flu shots. Some, as you know, there are nasal ones, others are injectable. So there is the one flu shot. Having said that, if there is a particular allergy to something that is in a flu shot, and that, then you should ask your physician or provider who's given you the vaccine. There does not appear to be allergic reactions to the Moderna or the Pfizer vaccine. So those are the first ones that have been out there, and more people have had those. So I think you would just get the right advice. But let me also remind people that we will have a flu season again, and we will need to get flu shots in the fall, and how that fits into the whole process is yet to be seen. But overall, the fundamental piece, or vaccinations, are good, and we should be confident that these are being tested and are safe. And I'm glad you're getting these questions of people getting the vaccine and thinking hard about the realities that we face to get the 2 doses and be back at school.
Dr. Ratson, there are some questions regarding the different types of COVID tests and whether or not rapid tests are reliable. I've certainly read different opinions on that. Some say antigen tests are even better to take than the PCR. And I'd like what you can tell us about that.
Well, There are different ones that are required for international travel. Some are required for different groups, and some are easier to get than others, notwithstanding the cost. So, all in all, the tests do go through some sort of rigor that they have to be approved still by the FDA and so forth. But the testing, I think, should be clear of what it will take to get back on campus. As President Boudreau said, whether it's the nasal swab that becomes a PCR test or a rapid test, that is enough to protect once you already have most people that are vaccinated and the right measures in place. So I really can't say. I do know the Excelsior Pass. Obviously, if you're in New York, you have the two or the single dose. You able to get the pass, and they're also accepting a certain number of tests also that would give people the QR code for a period of time. So I'm not totally up to date of which ones are approved and by which manufacturer, but I would just say the most important piece is especially if you're not vaccinated, to appropriately mask when you're around people that could be also not vaccinated, and do your best to get vaccinated as soon as possible.
And can I just say the current kind of CUNY policy discussion around tests is, I mean, one of the questions is, will somebody who will be demonstrating 7 days, that they've passed a test within the last 7 days, will they be eligible if they bring a test from someplace outside of CUNY? And right now, what we've heard as of yesterday was that's an item for discussion. I think the goal is to make testing on campus so broadly available that we can accommodate anyone. And then there's less fear about, maybe somebody took a test that wasn't that sensitive or something like that. So this is not settled policy. It is an item for discussion. And it's one of those things that will be clarifying as we go along.
Adriana, you wanted to say something a little while ago, I think.
No, that question was answered, but there was another question for Dr. Ratson regarding what's the likelihood of any of the COVID vaccines being FDA approved soon?
Well, emergency use authorization was important to get them onto the market to people as soon as possible. The regulatory process, just takes time for the numbers of people and so forth. There has been discussion, and it's a conjecture that this would happen sometime before the end of the third quarter in September. What I wouldn't say that this should matter to anyone who's listening about getting a vaccine. I think we have enough with 150 plus million people who've taken them in the United States, the studies that have been done to show that these are safe and effective and have the efficacy that we're expected. There are different pieces that will come into place once they have final authorization that will help in some ways, some of the rules. But yet the EEOC, the Equal Employment Opportunity Commission in the United States, has said that it's okay for companies to require it based upon even emergency use authorization. So no longer is there a wait only for FDA final approval, although there are some challenges to that at different levels. So all in all, I think the science is strong enough to get the vaccine. But it's an important question. It also could change some of the reimbursement, which is both a positive and a negative, depending on where you are on the schema. I'd also, frankly, like to see the vaccines eventually given in physicians' offices and make it as simple as possible, just like you're making it simple on campus for both the vaccine and the testing. I also noticed some people are putting things in the chat if you want more information, as the question before on the PCR test and some of the others. But I think all of us have to continue to be informed and follow what's happening from the FDA and the CDC. The CDC is supposed to be the prime public health agency of this country, and I think they have been doing their best to try to communicate the challenges.
Let me just say one thing. It was the other half of what I wanted to say earlier about vaccinations, and it's responsive to a whole category of questions that we see in the chat, where people are saying things like, well, how are the elevators going to be safe, and what kinds of work has CCNY done to keep the campus safe? And I want to say this: there was a long period of time when the only protection we had against the virus was cleaning and social distancing and PPE and masks and gloves and all of that. And so during that time, if you haven't been on campus since March of 2020, what you'll find is social distancing signs all over the place, hand sanitizers all over the place. In bathrooms, every other stall is shut down. The kinds of things you see in general in society. You will also see that we have done a lot of work to install the MERV 13 air filters where they are, and we're doing testing of air exchanges in rooms. There's a question about the administration building, and there's no windows, so how frequently is the air exchange? All of that is being tested. But it also, I just want to remind that one of the reasons why we're here having this conversation is that we are no longer in a place where that area is the only way to protect yourself. It is not even the best way to protect yourself. So will we practice social distancing? Absolutely. Are we making sure that the rooms that we open have adequate number of air exchanges per hour? Yes, absolutely. But most of those things matter much less for anyone who's vaccinated. And so will the college do all these things? Absolutely. Will we be transparent about what we're doing? Yes. If we have a room where we don't have adequate air exchanges, we won't open the room. Right. But if you want to be protected against the virus, if you want to make sure that whatever the air exchange levels are, or whatever your social distancing is, if somebody comes too close to you in a hallway or crowds you in an elevator, the best way to be protected is to be vaccinated. And a time is going to come, maybe when we reach herd immunity, maybe more than that, where as a community, we have to look at a situation where there is less social distancing and recognize that that's not where our protection comes from. Our protection comes from the vaccine and the number of people that have been vaccinated. We're not there yet, but you should know that in our efforts to protect the community, we have to work in both areas. We have to keep the physical space clean and our population separated from one another, but we have to also realize the benefits of vaccination and little by little recognize that that's where our durable protection is going to come from. It's not going to come from masks or gloves. It did for a long period of time when we didn't have the vaccine, but we're in a different space now. So I just wanted to make sure that I got that out there. Vanessa, where are we at with? So I'd like now to sort of more formally turn the town hall over to our moderator, Professor Valdez, and ask that she kind of walk us through the Q&A.
Yeah, I wanted to ask of you and Provost Liss to speak specifically to, what for some people is a very big ask, that idea of trusting the government, trusting the health agencies. We know that COVID-19 has disproportionately affected communities of color. City College is, as you say, the only college, the only university in Harlem, New York. And so a lot of the anxiety is particularly this idea of why should we trust the government, given that, we've seen the mismanagement of this. And I really wanted to voice that, again, with a specific, because there is, several of my students and fellow faculty and staff members have felt like there is a rush, right? There is a rush back to campus in the aim of, or because of capitalism and because we know that we need an economy that rebounds, but at the end of the day, there's an ignoring of suffering, an ignoring of grief, an ignoring of very real pain. And so I ask you and anyone of the executive staff to please to address that very real fear and very real anxiety rooted in communities of color.
Well, so let me take a first crack at it, and then invite the rest of my colleagues to come in. And let me start with kind of my knee-jerk response. Remember when the vaccine was first available, and remember when the only way you could get the vaccine is if you somehow had an in with somebody, right? People, wealthy neighborhoods were getting it, poor neighborhoods were not. People that were politically connected were getting it and passing it out to their friends. You'd see, you know, pictures of elected officials getting it, and you'd think, well, when's my turn? I mean, my turn didn't come along until March, and I wanted this vaccine as soon as it came out. And so what I want to say is, and this is a little bit of a flip answer, so don't take it too seriously. The harder it is for you to get to the front of the line of something like this, the more you can probably trust that it's worth getting there. It's worth getting the vaccination. So let me say that just to start. But the other answer is this. You know, as Dr. Ratson walked us through the FDA approval process, and he said, you know, phase 1, it's a couple hundred. Phase 2, it's a couple thousand. Phase 3, it's many thousands. We're now in a position in the United States where we have millions and millions and millions of people who have gone through this. And if you think about that as a kind of informal phase 4, let's put the shot in the arms of 100 million people. And how many stories have you heard of people that have gotten seriously sick from this? So for me, it's a question of it's a question of what the costs of getting the vaccine are in comparison to the cost of not getting the vaccine, right? So let me just say that, and I think we have to trust the science on that. In terms of Vanessa, you asked about the costs of trauma, and look, I just think we are collectively a traumatized society. We're a traumatized campus, but what's the road back from trauma? There is nothing in my mind that is going to be more healing to our campus community than the capacity to become a community once again, to sit together. I had my first in-person meeting with my senior staff, you know, admittedly fairly small group, 8 people in a room, sitting around a table, kicking ideas around. It was different than Zoom. It was just different. It was better. You could read people's body language. You could joke around with them. You could have a side conversation with somebody. And so I think the closest pathway back to healing the trauma, I mean, certainly addressing it, certainly talking about it. And I know Dr. Valdez, you and some of your colleagues have really talked about, and it's something I think is a terrific idea, convening workshops or gatherings that are less about the science of the vaccination or less about our reopening policy and more about giving people the opportunity to talk about what they've been through, what they've seen. And so that's important. But I also think there's a day-to-day strength that we draw from being able to be with one another, just be with one another, that is going to be enabled by this vaccination. And again, I think there's going to be a kind of a hangover that we have to shake off, where you come to campus and we've been living for 15 months where the proximity of other people has been a threat rather than a source of support. And the way that the vaccination protects you from the threat of the virus is still kind of largely invisible, right? But you know, so I'm in an elevator today in my building going down, and a family comes on, father, mother, little girl, and they're going to a park to catch butterflies. And the little girl's 2 years old. She's totally excited. And neither parent is wearing a mask. And they come in and they see me and I got my mask. And they say, oh, I'm sorry, you don't have a mask. And they step out of the elevator. I was able to stick my head out and say, I'm vaccinated. And they said, well, we're vaccinated too. And so then we got in the elevator together. And Vince out.
It's not graduation, Vince. So I will also say for myself, and one of the things that I haven't heard really talked about, one of the surprising effects when I went to go get the shot, I got the Pfizer vaccine, was I was surprised that I felt like I was doing something for the rest of the community, right? I felt like, which was completely unexpected to me, right? I felt like, oh yes, there's keeping me safe, but then in doing this, I'm keeping others safe, right? And when I spoke about it with my classmates, I said, you know, I live around, several people in my building are older, right? Are in their 70s, their 80s, their 90s. And this was the way that I could keep them safe, right? Because we know that a lot of transmission is asymptomatic, right? And so while I think of myself as being in fairly good health, right, I still wanted to take that extra step. But I am also someone that, a good number of us are very conscious about what we put in our bodies and, the shots that we take, the medicines that we take, and we aren't just taking anything, right? And so I do want to give voice to the vaccine also being a way in which we keep each other safe, right? Not just our individual selves.
Vanessa, if I could chip in, you asked at the beginning of your question, you asked, why should people trust the government? And I do not have an answer to why people should trust the government. There are lots of reasons not to. And I think that my reaction to that is find people that you do trust and talk to them. And I'm looking, and I'll put it in the chat when I find it. There's a wonderful video from the New York City Department of Health with the commissioner, all doctors, all people of color, men, women, all talking about why you should take the vaccine and why you should trust it. And I find that to be a very powerful commercial. And so I think, and I will put it in the chat as soon as I find the link again. But I think the answer is find people that you do trust and talk to them, but be careful, because talk to people who know what they're talking about, because there is a lot of misinformation out there. And that's why I point to this video of the doctors from the Department of Health, because they are experts. It's the head of the Department of Health and other people. They are, and it's a 90-second commercial, and it is absolutely perfect. It's pitch perfect. So I will find it in a few minutes and I'll put it in the chat or in the Q&A.
Thank you. I also wanted, Provost Liss, since you're up, I did want to address, one, to Scott's point, to Dr. Ratson's point about building vaccine confidence, right? I do think that I think probably circulating why those of us who have been vaccinated, why we are vaccinated actually would be powerful, but also questions regarding movement of people on campus. Provost Liss and VP Iyer probably, or anyone who wants to take this up. There are folks who, have in-person classes combined with online classes. I know you have answered several of those in the Q&A, but could you please give voice to how will people be moved and shuttled on our campus? Are there going to be specific places? Are there going to be signage? Any of that?
So we do plan on providing for the safety of travel around campus. Campus as it's set up currently is set to do that. We have signs that indicate which side of the hallways you should travel and directional signs for various hallways. Some of the challenges that we're facing have to do with our transportation systems, such as elevators and stairwells, but elevators in particular, particularly in Marshack, where all of our elevators are banked on a single call system. So it's difficult to set them up so that we could set aside, say, 2 elevators for non-vaccinated people and the remaining set of elevators for vaccinated people. Because obviously the number of people you could fit in an elevator would be dependent upon that. But we're still looking into ways of doing that. And in buildings where we have multiple banks of elevators with different call banks, that's what we're going to plan out. So in the NAC, maybe the north side elevators will be for non-vaccinated, and the south side elevators would be for vaccinated. In addition to that, we'll have not only our main bathrooms, which would be used by vaccinated people, but we have numerous single occupancy or limited restricted occupancy bathrooms for those that are not. For students that are taking a mixture of in-person classes and classes that are online, we have plans to reopen our library and our tech center. The library has numerous floors, and our tech center is on the first floor of the NAC. The perimeter of the tech center is set up so that every other workstation is shut off, and this is for two reasons. We have the people that are taking online classes that still need to remote into a computer that has the software that they need. So those are blocked, those computers are blocked off for that purpose. But it also helps distance people apart because every other computer could be used by a person on campus. And then we have two 35-seat rooms and a 50-seat room within the tech center that we can make determination based on, you know, most of our students they should be vaccinated because there's a vaccination requirement for students. But if for some reason we have a subset of students that are not vaccinated and need to socially distance, we'll provide that space as well. But I know a lot of the comments talk about concern about room, but once again, students will be vaccinated, and we do not anticipate anywhere close to the number of students during a normal semester. We're looking at about 50 to 60% of our classes having some component of in-person. And what a majority of those classes are hybrid classes where it's most likely that the faculty is wanting to teach the classes online, but have testing happen in person. So there may be a mixture in there, and I hope that some will use HyFlex and some of the other technology pedagogy methods, but in reality, not that many students are going to be on campus this fall. So I don't think we're going to have any sort of issue with space for them to work with a computer. We also have our reservation desk where they can check out a computer and find a spot that has Wi-Fi, whether that be in an empty classroom. You know, we're thinking of some of our lecture halls that are larger while they're not in use, being able to utilize those spaces for students that want to come in. But I think we're going to be fine with the library and the tech center. But if not, I can promise you we will find additional space for the students that need those type of services.
So just to quickly follow up on what you've just said, will students be able to check out tablets or laptops if they don't have them?
Yes.
And then move to those spaces as you just said?
They certainly will.
Okay. All right. You've also just brought up the idea, the mandate that students be vaccinated. There has been no such mandate thus yet from the governor about faculty and staff. And so, and again, this is open to anyone who will answer this question. There is some concern on the part of students about what if they are being taught by or somehow serviced in from the various offices by folks who are not vaccinated. And so is there any conversation about that?
Yeah, if I can on that. So let me say a couple things. First of all, it's come to my attention that many students see this as a kind of unfairness, right? That faculty are allowed to come to campus without being vaccinated, students are not. And the answer is it's kind of a bureaucratic answer, right? Faculty and staff have a contract, they have an employment contract. And the university, the college has an interest in starting to bring people back. And so we had to figure out how, and since the FDA has not finally approved the vaccine, we cannot both require people to come to work and require that they get the vaccination, right? Students don't have that same dilemma, right? Virtually all students will be able to take a full schedule off campus if they so desire. It may be different from some majors, but we're looking right now at a situation where more than 50% of our classes continue to be offered fully online, and of the remainder, a very, very small portion are only in person, right? Most of them are kind of hybrid where you're mostly online and you're coming from time to time. So where does the real danger? I mean, so there's a real danger there, right? If you are an unvaccinated student who's in a classroom because you got a test over, within the last 7 days, that test doesn't protect you from getting an infection from a faculty or staff member who may be carrying some kind of a viral load, right? So there's no way to I don't want to sugarcoat that. If you've made the decision that you're not going to be vaccinated and you're going to be on campus, recognize that the current policy of you have to be test negative within 7 days. A lot of things can happen between when your test comes in and when you come to school. So that's an okay protection. I mean, the other thing that we should bear in mind is that the infection rate per 100,000 every day is dropping very, very low. So right now in New York City, what I saw in the Times yesterday is less than 3 people per 100,000 are getting the virus. Its current sort of last 14-day average, right? So if you come, so let me say this as clearly as I can. If you come to campus without the protection of the vaccine, you are putting yourself at some risk, right? As more and more members of our community get vaccinated, as we start to reach herd immunity, that risk diminishes. But the best way to protect yourself, if you want to be on campus, the best way to protect yourself is to get vaccinated, because even vaccinated people still have a much reduced viral load. So it's not zero, and their ability or the frequency with which they will spread the vaccine is reduced, but it's not zero. I wonder, Dr. Ratson, I'm kind of getting into your territory here a little bit. So, I mean, first of all, is there anything that I said that was inaccurate? And second, is there anything that you want to add to what I've said about how the virus operates?
No, all I would say is you're quite accurate in the fact that it is good that there's less circulating virus and people should pay attention to all of the pieces. But by all means, the vaccination is key. And I think Vanessa's also mentioned the key area. It's, yes, it protects you, but it also protects other people who you know and care about. So that is, I think, the important message. It's just a question of time to get to the right number. And I think the university and government and others that do follow some appropriate regulations that we can trust are all trying to do the right thing. And I think it's a testament, and really thank you and CCNY for putting this together for your students and staff and others. We should continue to have the dialogue, because that's the only way we're going to have the right understanding and have the fundamental confidence. And your personal ability to communicate this has been really excellent, as well as each day looking in whether it's the Times or Gothamist or your social media, and be able to get the sources of people that you trust and know, and know that you have CCNY as part of the family too, and the Koukuni system. So thank you for the opportunity. I really commend all of you for what's been said, and all of you have been avid in the chat and the Q&A from Adriana and others, as I've been trying to focus on multitasking, as we all do these days. Thank you.
Could I ask Adriana? We haven't had a question come directly to you, but you have done research on what our students are thinking about the vaccination. I wonder if you want to just share a little bit about what you're seeing in the data among our students.
Yeah, so we've had questions in the Q&A. Really, everybody has their own specific issue, and they are very similar to what we have found at City College. And it's basically fears about the side effects of the vaccine, and really that we go with the emotions associated with that anxiety, or just we hear that somebody got a real bad side effect and then they had other complications. And so we hone in on those emotions, and we just really fear the vaccine more so than the virus. And so what we need to understand is that the complications due to the virus far exceed any possible complications due to the vaccine. However, and Dr. Ratson, maybe you can clarify what I'm trying to articulate here, but it's that we tend to make a lot of emotional decisions, and those emotions are based on the fears that we have that are exacerbated by social media and maybe our families and any other friends that we may have. And so one of the biggest concerns that if we were to throw in a blanket reasoning for it is just the misunderstandings of what are the side effects of the vaccine and how much at risk am I? And that latter part is really only answered by talking to your healthcare provider that will give you answers to your own case specifically, right? We can't really generalize based on the one story that we hear here or there or anywhere else. That was the biggest issue that I've seen here so far, and that we've found at City College is just misconceptions or fears about the side effects of the vaccine itself. And there's also, that's exacerbated by some reports that suggest people have died, that these many people have died due to the vaccine. And so that's something that was raised in the Q&A, and I would like for Dr. Ratson to talk a little bit more about is, we have seen that there are some information out there about long-term side effects of the vaccine that may be true or not, or that are just hypothesized. And if we could clarify that to the people here, that would be fantastic.
And also, can I just ask Dr. Ratson in conjunction with that to really break down, what does the vaccine do? What does the vaccine protect you from? Can you be infected if you are fully vaccinated? Because I think there are people who are like, I get the vaccine, this protects me from infection. And then we hear about, the Yankees, 2/3 of the team or a third of the team getting infected, and they're like, but what happens? And so could you please just really break that down? Why are we getting vaccinated? What are we protecting ourselves and each other from?
Well, the reality is this has been the worst infectious outbreak we've had throughout this country and world in many of our lifetimes. And we saw in New York City at the center, we didn't know how to treat people. We've seen in different parts of the world now, there's not enough oxygen. And this virus continues to get worse in different parts of the world. We call new variants. Some of these variants are much more transmissible and are still killing people every day, although the numbers luckily are much lower, very low in the New York area. Some states that had outbreaks before are reporting zero, but it's not zero in certain parts of this country where vaccines are not taken at the level that they need to. I'm basically talking about the South and many other countries. That front page article in the New York Times 2 days ago just had a colored map, and we're fortunate to be in one of the safer places in the country. But the virus can still infect people. And what happened with the Yankees, most of them, we're talking about the vaccine, but there is a little bit of difference. They had the Johnson & Johnson vaccine. All of them were not, the amount of time that would be necessary to get the full resistance that you would get. We don't know about of all of the protection. And they were also in an enclosed small space, is my understanding. So they still weren't wearing masks. They were, whether it's a dugout or what have you. And if someone was infected, it was easy to spread. So yes, you can get COVID even if you are vaccinated. And as you recall, 72% efficacy, which means it would work 72% of the time, the J&J vaccine. Yet the vaccine, which is clear with the trials, no one gets hospitalized or dies, even if they are infected with COVID, if they had the J&J vaccine. That has been, the study has shown that, and the data support that. So you still are getting some immunogenicity, some sort of response that the vaccine is priming your system. So it is protecting you. So if someone, we used to get questions, if I get the J&J vaccine, should I take it if I can't get the others? And the answer is yes. Right now, people should get any of the vaccines that are available to them. However, they still, especially in that period, you can't say, wow, I got my vaccine, I'm ready to go the next day, because it takes time. And even after the second dose of the Moderna or Pfizer one is still another 14 days. So I think we're somewhat in that area. In terms of the long-term safety, the long-term safety certainly seems to be there, but none of us can say we know the vaccine hasn't been around for over a year or two or what have you. But the point is that vaccines generally, from what we've always looked at in the past, that as this is a third century technology of using this to prime your immune system, there are not long-term effects that cause cancers or any of these pieces that have been floating around. So there's no reason to believe that would be the case. There's also been discussion in the past of what preservatives are in vaccines. Is there mercury? You may have heard that. There's none of that in these vaccines as well. So there really isn't anything that would predict any long-term issue from the vaccine itself. There is, and even if people, we all have heard about long COVID. There are people that have been infected and they think they're better, but they have long COVID symptoms. So it's been as clear as ever from President Boudreau at the beginning, the risk of getting COVID is still much higher than the vaccine. So that's almost as clear as I could say it. You can go into the nitty gritty of how vaccines work and if we'll need a booster and so forth, but those are the what ifs. Right now, we know we can protect, and that should be what we try to do. And particularly now, when we get back in the fall, I think hopefully the system will even be clearer that we'll all be protected and hopefully get to that 70% plus number. So I support the month of action. The higher that you can, if you know anybody here or in your social media network or any network to get vaccinated, now is the time to do it.
Thank you. There have been several questions and comments regarding transportation to campus. Those of us who are watching the news or reading the newspapers, we see that there's on an almost daily level or daily basis crimes happening, violent crimes happening on the MTA. And so we have shuttles to 125th Street. Could we speak to precautions regarding transportation to campus?
Well, right, we have both shuttles to from 125th Street and also from 145th Street, the A train station. Pat Morena is here. We have in the past, and I want to, the pandemic has really changed a lot of our staffing. So I don't want to announce a policy if we're not able to do it. But I know in the past that we've been able to escort students in security vehicles. If there's a reason to do that, it's late at night, the shuttle's not working, or something like this. I do want to say, we have had in the last several months any number of violent incidents in the immediate perimeter of CCNY. I mean, we're not just understrained as individuals or as a campus community. Our whole society, our whole city is suffering from the social, economic, psychological effects of this pandemic, and so these are more dangerous times than they had been before the pandemic, not just because of illness, but because of the dislocation that the pandemic has created. So I wonder, Pat Morena, could you just tell us what, like, if a student is feeling unsafe on campus or unsafe moving from a subway station to campus, what sort of facilities do we have?
Oh, that's a good question, Vince. And we will provide a safe escort, but it is on a case-by-case basis. And it also comes down to the availability of public safety and how many officers we put out on patrol. The shuttle, we encourage the shuttle bus service. As far as safety on campus, we patrol 24/7. Our campus is constantly being patrolled. Our access areas are being patrolled. Our safe passages to and from the subway stations are being patrolled. And we're in constant coordination with the local precinct as well as transit, coordinating any crime trends and responding accordingly.
Could you talk about the blue light call boxes on campus as well? I'm not sure, that kind of fades into the background.
Yeah. So the blue light is a safety precaution. If an individual is feeling unsafe on campus, there's the blue lights on campus that they could go to the blue light, radio the dispatcher, and we will dispatch patrol to that area.
Right. And of course, the very safest thing you can do is travel in a group. You know, that when the subway disgorges City College students and faculty and staff, it does it in groups. And so stick with a group of people. If you're doing a late class, you might want to say, you know, who's going to the A train and travel to the A train together. You know, 3 people are so much safer than 1 person. So.
And Vince, if I could also add, we do have safe haven locations throughout the campus, and there are stickers in windows of local establishment that have the CCNY safe haven. And if a person is feeling unsafe, they could go into their location and they'll call public safety and we will respond.
Okay, all right. So what that means, I think, for our campus community, look, the reality is we're an open campus, and we like that because we value our connection with the community. But that means that all of us as individuals have to educate ourselves on the ways in which we can protect ourselves and make use of the facilities that the college has to offer.
Is there going to be distancing on the shuttles by any chance, or are they going to be seated as normal?
I don't know that we've crossed that bridge. It's a little tricky, right? Because on the one hand, you want to keep people safe inside the shuttle. On the other hand, if half the people are left on the street corner or have to walk, there's a different kind of risk there. So I think that's something that we'll have to think about and study. I mean, bear in mind that we are, as I think Ken said earlier, we're going to have greatly reduced numbers of people on campus on any given day, right? So a student who is on campus may be on campus 2 days a week instead of 4 days a week or 5 days a week. Same with faculty, same with staff. So it's something to work on.
Can you speak to CARES money with regards to monies were supposed to be, I think, earmarked towards counseling, towards what we are doing? I could speak a little bit about workshops that are in conversation, but if you could speak to what has happened with regards to, you know, funding for these efforts on campus.
Yeah, you know, we're only just beginning to get sort of the bulk of funding. We got an early tranche of money for mental health counseling. I wonder, Vice President Lloyd is on the call. Celia, could you just talk about how those monies were spent? I know some of it was spent to fund efforts in the psychology department, but of course we also have a wellness apparatus, and I wanted to see if you can talk about that.
Right, and the rest, Vanessa, was spent in our counseling center. In our counseling center, we one of the things we know is that the funding will be extended for another year, right? So we're in the process of, and I responded in the chat, we need to put a proposal together, submit it to our finance office, so we can get some additional resources into counseling.
But Celia, can you talk about like the number of like what did we do so far? Who did we bring on, and how does that broaden the services? We
brought on, I don't remember the number, but we brought in additional staff in the counseling center and also in the psychological center who've been working on services, and those staffs contracts have been extended for throughout this coming year.
Okay.
Yeah, I can get you the numbers later, Vanessa, just as an FYI, but we have additional personnel.
So we're going to be posting the transcript of the Q&A edited so that we don't have a lot of repetition as an FAQ, and we'll put some more precise numbers about who we've got and what the hours are in that.
But I also did want to say, Vice President Lloyd, as a faculty member, to be able to tell my students that the counseling center is there, that the psychological center is there. I just want to really, I thank you all. Thank you for the work. I mean, particularly the counseling center and the work that they've done to set up workshops for students, for community, like for being in person, individual group sessions, all of that. I mean, the counseling center has done a great job in communicating out their increase in services. And so I really want to acknowledge that out loud, because I think sometimes we don't acknowledge to each other out loud what different offices are doing on this campus. And that has actually been a tremendous resource for our students and staff and faculty. So thank you.
Yeah, and thank you to the counseling team. Yes, thank you. They have done a yeoman's job with limited resources. So thank you.
There are several questions regarding facilities and airflow and all of those technical questions. And again, we know of rooms on that campus that the windows do not open, or the ventilation is not well. Again, can someone speak to not only what has been done, which Vince, you spoke about filters being put in, but also just in general, what is happening
With
with
airflow.
those?
Yeah,
Yes,
Vanessa,
David Robinson?
I've actually been answering all of those questions in the Q&A as they've been coming up, and I was in the middle of typing another answer as you started talking. So let me offer you what we've been doing since March of 2020 on our campus as it relates to our HVAC systems. We have an excess of 120 air handling units on our campus. All of our air handling units that accept recirculated air are fitted with minimum MERV 13 filters. I do have one exception on that, which is 4 air handling units in the Marshak building and 6 air handling units in the Compton Goethals building, which have a different style filter. Those filters are currently being renovated. Those air handling units are currently being renovated with the assistance of CUNY and DASNY to be able to accept standard MERV 13 filters. So, and that work is currently underway, and it will be complete by the opening of the fall semester. So with that work complete, all of our air handling units on campus will have the minimum CDC recommendations of a MERV 13 filter. In addition to that, all of our air handling units have been serviced, inspected, and maintained. And we also monitor the operation of our mechanical equipment that's part of our HVAC systems on a daily basis as part of our daily rounds. Any repairs that are needed, we do. And we're also in the process of randomly surveying sections of each building that are serviced by the various air handlers to make sure that we are getting the requisite airflow that we would expect in those buildings. As you can imagine, with 3.4 million square feet, there's a tremendous amount of rooms, tremendous amount of supply registers that we have in all of our buildings. So what we are going to be doing is a cross-section, representative cross-section for I'd like to say all of our air handling units. This is going to be a yeoman's task to do that, but we're going to shoot as high as we can. And even after the opening of fall reopening, we're going to continue with that. Ideally, by the within a year's period, I'd like to say that we're going to have many more rooms completed than we have at our fall reopening. We're going to be very transparent about our HVAC systems in our buildings, as we have been all along. Where we have limiting conditions, we will be identifying those. Our opening plan has a section on indoor environmental quality, and in that opening plan, it does talk about 2 limiting conditions that we have. One I just spoke about. Another limiting condition that we have is in our Shepherd building, where a project that was done many years ago resulted in some purge dampers and some smoke and dampers being closed. We're working with DASNY to rectify that so that we're going to be improving the ventilation in that building. But in the meantime, for rooms that we identify where we have compromised air circulation, we will be implementing some engineering controls, which would include opening the windows, because in the Shepherd building, we do have movable windows. So we will be cracking some windows to provide additional ventilation. And also we'll be installing portable air purifiers in those areas that have the compromised ventilation. So with those 2 engineering controls, we'll be able to provide adequate ventilation and conditions for those portions of the buildings. So again, what I want to just add about our HVAC systems is that they are in good condition. They've been inspected by CUNY. We've been working with CUNY for many months, as CUNY also has been working with all the campuses to identify what air handling units we have, the condition of the air handling units, which ones may be problematic, what needs to be done to upgrade any of the air handling units or renovate air handling units. And right now, I think that for the fall reopening, we're going to be in a really good place when it comes to ventilation.
Let me just say two other things about that. The first is that we have been authorized, given permission, requested to begin to do tours with representatives of all the unions, right? So all of, DC 37, the PSC, we will be putting together tours of our facilities to give people, every confidence we possibly can that these areas are safe. That's the first thing I wanted to say. The second thing I wanted to say, though, is this, and it gets back to my main theme. I personally will go anywhere on campus. I will sit with anyone, any room on campus because I've been vaccinated, right? Like the safety of air handlers, the safety of social distance, all of these things that we do to protect the virus from circulating in our environment are paltry responses to the dangers we face as compared to securing our bodies against whatever virus we come in contact with, right? So I understand that people are wary about, where there's good circulation and bad circulation. And as David said, we've been working on that, and we'll continue to be willing to show people the progress we've made in that area. But I personally, no, I don't want to get sick. I don't want to get sick any more than anyone else on this call wants to get sick. I would go anywhere on this campus and sit with anyone because I have the assurance of having been vaccinated. And really, that's the thesis of this entire town hall. We're going to work on all fronts. We're going to try to protect everybody as much as possible. But there is no protection that is stronger than the protection you get when you make the decision to be vaccinated. Vanessa, I'm afraid we're running out of time. We were scheduled to go until 1:45. But the good news, so the couple good news is, number one, this will be posted, this transcription. We're going to edit out the little piece where I got choked up, but apart from that, it's all going to be publicly available. Number two, this will not be the last of these, and it won't be the last of these because A, we want to get the message out, but B, there's a lot of realms here where policies are going to be changing pretty quickly. We still don't know, for instance, what our testing protocol is going to be precisely, and I would like to be in a position where I can tell you exactly what that's going to look like. We're not able to say now precisely of how you're going to demonstrate that you've been vaccinated. We think it's going to be a combination of something online like the Excelsior Pass and maybe something on an ID card if you don't have a smartphone or you can't get that pass, but we don't know precisely. And so we will continue to keep you abreast of these developments, and we will continue to have gatherings that are designed to address other needs of the community, the trauma, uncertainty, academic preparation, all of those things. So I want to thank particularly Dr. Scott Ratzon for being with us. He is with us here via the good graces of the CUNY School of Public Health, and so their dean Ayman El-Mohandis was immediately responsive to my request, and so Scott, I want to thank you for taking the time to be here. I want to thank everybody, participants and members of the panel that were here. Vanessa, I think it's only fair to give you the last word on this. So take us home.
Well, I just want to thank everyone on this call. There were close to 450 people on this call. So again, just speaking to our hunger and our need to actively be in community with each other. And so thank you, President Boudreau and Provost Liss and all of the VPs on this. And just again, please everyone know that we are deeply invested in making sure that we are safe as we come into fall 2020. But in the meantime, please have a very safe summer 2020. Take good care of yourselves.
Bye-bye.
Bye.